Welcome everybody to the April 2024 Health Equity Webinar Series. And our topic today is work policy, worker protections, and health equity. I'm really excited to introduce our two speakers. As many of you know, I'm Lydia Isaac. I'm the Vice President for Health Equity and Policy at the National Urban League. And joining me today, we have our two esteemed colleagues. I've worked with both of these people. They're wonderful. They're smart. I'm so excited that they're here. And we have Jodie Easley, who's the co-executive director of the National Get Out the Vax campaign, which we work with on our vaccine equity work. But what people don't know and what Jodie's going to tell us about, for those who know Jodie on the call, is that he is and was a former union organizer. And so that's why he's here talking about this. And then we have Dr. Emma Tsui, who is associate professor at the City of New York Graduate School of Public Health and Health Policy, and has done a lot of work and research thinking about how different workers in the healthcare system are treated, and their roles, and what happens when you talk about hazardous conditions that they live in and work in, and how do we mitigate and work toward that. So I'm really excited to have both Jodie and Emma with us. And so I'm just going to let them introduce themselves and talk a little bit about their work in general, and then we'll get into some deep, good conversation. We already started having some good conversation before you all joined, so I'm very excited about this. And I am going to start with Emma.
Great. Thank you so much. Thanks, Lydia and Lillian, for organizing, and everyone at the National Urban League, and Jodie, who I'm excited to be in conversation with today. So I'll introduce myself a little bit, but I just want to say also that I'm so happy that we're having this conversation about work as a social determinant of health. I think it's not in the spotlight as much as it should be. And I think that, especially thinking about the affiliates and the ways that work and community health can be intersecting, and the ways that workers bring the risks that they face at work and the stress that they face at work home into their families and their communities, I think that is a site where we could really be doing a lot more around worker protection and policy. So I'm excited. So as Lydia said, I do research around promoting and protecting the health of a variety of kinds of marginalized workers. And in recent years, I've been really focused on care workers of different kinds, and particularly focused on home care aides, who are such a rapidly growing workforce. For any of us who are caregivers or who have needed care, we know how important they are, and yet they're so undervalued in society. And their health really is at risk in a variety of ways, both physical hazards and psychosocial hazards. So that's the work that I've been doing, mostly in collaboration with unions. We do have unionized aides here in New York, and in collaboration with agency colleagues.
Thank you, Emma. Jodie.
Thank you. I'd also like to extend a thank you to Lillian and Lydia for organizing this. And Emma, it's nice to meet you. I'm really excited to have this conversation to the National Urban League. As Lydia said, my name is Jodie Easley. I am currently the co-executive director for National GOT Vax. A little bit about what that program started as was a vaccine equity program. Really, how are we using campaign proven strategies to boost vaccine uptake in communities of color? And we were lucky enough to partner with the National Urban League and work with them on really like digging into communities where affiliates were, and how we boosting that boosting vaccine uptake over the last few years. And again, like I said, particularly using campaign proven strategies. So like our team brings labor, community organizing, and campaign organizing to the table, and how are we applying that to health equity work. As Lydia said, prior to that, I spent about 17 years roughly as a union organizer and campaign director. And for most of my career was with the National AFT, American Federation of Teachers. And what's really interesting and great about this conversation is, as we really talk about and take a step back and look at social determinants of health, it's really starting to become apparent that there are so many civic and social actions that people can take and engage in that are going to have a direct impact on their health. right? You look at the NIH just 2 years ago deemed that voting rights and voting access were a social determinant of health, right? So and we understand like particularly how that impacts marginalized communities and communities of color. So this conversation is really great. It's really poignant at this point. Um, just happy to be here and happy to be in conversation with you guys.
Trying to get myself off of mute. So I love this introduction, and I love, thank you, Emma, for starting us off with really the basis for a lot of the work that we do here, which is that social determinants work, right? What are the things that are happening in society and in the environment, the social environment, the physical environment, the work environment, the school environment, the climate environment, right? To the neighborhood environment that's impacting people's health and their ability to access health resources. So can we talk about how work in particular, in both of your roles is a has really played a large role in how people want access healthcare. So, many of us know that, if you don't have a job, sometimes you can't get insurance, especially if you're not eligible for some other things, but also to how work can be a hazard for your health. And so there's these two really interesting roles that work can play, which is getting you access to the care you need, but also putting you at risk for poor health outcomes.
Yeah, I mean, I feel like you said it so well, Lydia, that good work is good. Good quality work is good and can also be very personally meaningful and rewarding, as I'm sure a lot of us on the call can have felt. And it gives us, access to income, access to paid leave sometimes, access to healthcare benefits and other kinds of benefits, as you're saying. And then there's poor quality work that can, put us at risk of all kinds of physical hazards, all kinds of psychosocial hazards. And I think it is that kind of uh, dual personality of work that gets really complicated. Plus, then there's the added layer of when we can't get access to work, when we're unemployed and don't and want to be in the labor force. And so I think there is some complexity around how we think about work as a social determinant of health.
I think you kind of hit the nail on the head, Em. And the only thing I would add is if you look at there's sort of two competing uh, statistics really. If you look at the amount of workers who have access to healthcare, and I'll color my own opinion in this, particularly unionized workers that have access to healthcare and what that means for, you know, if you're in a unionized workplace, you are 12% higher rates of employer provided healthcare. Um, but I think the other thing is that being able to advocate for yourself and to advocate for healthy working conditions as a person on the ground is going to play a big role in that. The COVID pandemic was a huge uh, mirror of that, right? And if we look, it's interesting because there was only one scientific study that looked at this, and we have all kinds of anecdotes to talk about, but there was only one study that looked at this in 2021. But what the study found is that unionized workplaces had almost 20 to 30% lower COVID-19 infection rates than other places. And I think to your question, right? Like that is a matter of workers being able to advocate for their own healthcare and or their own working conditions.
So I want to, this is, you just brought me to a good point, Jody, which is this idea of worker protections and policies in the workforce and the workplace that protect or don't protect, right? That cause hazardous conditions or don't protect workers. Can we talk a little bit more about what some of those actually can be and how do they come about in a workplace, right? How does somebody get those protections? What are the policies that one maybe federally mandated that people are not paying attention to, or state mandated that people are not paying attention to, that can help workers to make sure they're in a workplace that is safe, and works toward their well-being.
Yeah, I mean, I would love to tell a story, which some people may know, that has to do specifically with home care aides and federal policy. But so, home care aides, for those who aren't aware, are people who are helping older adults, people who are disabled, people living with illness, to stay in their homes by helping with the activities of daily living. So, this is, really, really important work for our societal health. Um, but they have not had a lot of labor protections historically. And one of the reasons for that goes back to 1938 and the Fair Labor Standards Act. So, this was a really landmark piece of legislation, a cornerstone of the New Deal, and provided some really important minimum wage and labor protections for a lot of workers in the United States. But at the time that this was being negotiated and legislated, Southern lawmakers who spoke up because they did not want white workers and Black workers to be paid the same wage for the same work. And so there were exclusions from that federal worker protection legislation. Um, and most of those excluded industries were industries in which Black workers were more prevalent. And so one of those exclusions was domestic labor. And for this reason, from 1938 pretty much all the way up until 2015, home care aides were excluded from the basic wage and labor protections that most other workers had. And so this is, I think, an example of a really good piece of legislation that was then compromised around some particularly marginalized worker groups, that was just very problematic. And I'm glad we've moved to a place where they now have those protections, or some of those protections, but just speaks to the importance of federal labor policy.
And just to add to that, I think if you look at the establishment of OSHA, right, in 1969 when they signed the OSHA law, um, the the reason that that law even came about, or the reason the federal agency, I'm sorry, even came about was a large public outcry around worker conditions, and that public outcry was actually extending from workers on job sites, um, walking off of the job basically because the conditions were so bad. In a few different industries, mining, oil, and a couple different industries that really sort of drove that. And I think to Emma's point, right, it's and even in that, right, because of the way that it was implemented, uh, there are OSHA is a federal agency, but the implementation is different state to state, and you'll see a correlation between states that have strong worker rights policies and are also the states that are going to have stronger worker safety policies, and the flip side to that is states that don't have strong worker rights policies have lesser standards for worker safety. So
So you just made me think about something. So for those who don't know, OSHA is the Occupational Safety Health Administration. It's usually the ones that people will call if there's something going on a work site and they possibly get people to come investigate. But as with, and we've talked about a lot in this group with things like Medicare, Medicaid, sorry, and other and state health insurance programs, they are run through the states, right? So even though it's a federal mandate, the states are allowed to kind of make decisions. Can you talk to, because I know there's going to be people who listen to this webinar later, maybe not who are on this webinar right now, who will say, well, if I'm in a state with strong OSHA protections, I'm a business with strong OSHA protection, why don't I just go to a state with not strong OSHA protections and then I don't have to worry about this for my workforce? What is your kind of, and I mean, I know the answer, but I think we hear this argument a lot in states who are like, well, if I make this too stringent, then businesses are going to leave, and then that's going to impact my state even more because of the economy and jobs and all that other stuff. What would be your kind of rebuttal to that argument? Go ahead, Jody.
I'll take that one first. So I'll also another hat that I wear is I'm also a small business owner. So I have I will throw that out there also. Yeah, typically people that say that strong worker protections mean that it's going to affect my bottom line. Um, One, there's a ton of statistics and research to show that that's not the case, right? If we look at profitability over the long term for businesses that have strong worker protections, what you find is that you have lower healthcare costs as a business, you have lower turnover rates as a business, you have lower attrition. The worker safety policies actually make your business stronger because the workers, and also their correlation that people often don't make. Worker safety policies also transfer over to your consumers, right? So for instance, if you operate a facility, you have a lower insurance rates because you have higher standards for safety that you have to meet. Um, but also, like I said, there's a ton of research that shows us that by increasing worker protections and worker rights, you're not decreasing your bottom line. You're actually, in a lot of cases, over the long run, going to increase the profitability of your business if you're in partnership and in a working relationship and not, expending resources to fight against it. Um, there are, there are a ton of states that there are very profitable businesses that choose to be there because of what those standards, what that means for quality of life, et cetera, et cetera. Um, and actually, kind of going back to a point that you made earlier, Lydia, if you look at the 10 states that have not done Medicaid expansion yet, right? The correlation is that they're also, I think 9 of the 10 states are, if you look at the indexes of worker protections, are states that have the lowest worker protections. There are also states that have the lowest workers' rights laws. So, and I want to say 5 of those 10 states, if I'm remembering that correctly, are also states where are the lowest poverty in the country, right? So, like, I mean, if we're doing all of those correlations, right? Like, the more that we take away from workers' health, rights, et cetera, right? The poorer people are, the worse the state economy is going to be.
Well, I think that was well said, and we
I was
won't.
about to say, I was about to say the same thing
I was
so
gonna say we
well.
won't name the states, but I'm sure many of you can name the states, right? Um, so I don't know if you want to answer a little bit more of that, Emma, or if we want to move on. But I think you had something to say on that. Yeah.
No, I think Jody said it so well. And I think that, that question of attrition and turnover and the costs associated with that, if people are ill, if they're leaving, that is very significant. And I mean, that's certainly something that we see in the home care industry where there's a lot of turnover and it's a significant burden on businesses. And as Jody was arguing, has a real impact on the quality of care that they're able to provide because of that turnover and attrition. And, this is healthcare and support. So it's really important to our societal health.
Thank you so much for that. So let's also go a little bit to. I'm going to go positive because I think Emma, you really kind of outlined very early on the Fair Labor Act, which talked about like how where we have gone in terms of improvements for worker protections. What are some of the policies and actions that are in place or could be in place to improve worker protections and worker health across kind of the spectrum? Because you work with home health aides, which is a very kind of demanding, physically demanding job. Jody used to work with teachers, which can be, and I want to ask a separate question about teachers in a minute, but let's talk about that, and then want us to talk about things that are coming further on that could possibly impact the health of those workers. So how do we think about broad-based policies and actions that can help workers across the spectrum of different activities and different types of labor forces?
I mean, one piece that I'll just throw out there initially is the importance of paid leave policies. I mean, I think people coming to work sick, coming to work injured is so problematic. And yet, when we don't have these kinds of paid leave policies, we really run the risk of that, and people are doing it all the time in order to make ends meet. And so I think from a health equity perspective, we really need those kinds of policies to be widespread and strong and protective.
Before you move on, can you talk? I just want to talk a little bit more about, because maybe everybody doesn't know here that like paid leave is not a guarantee, right, in this country. And so, like, can we talk about that history a little bit and what that means and why and how are, I don't know if you know this, Emma, but like, who gets paid leave, who doesn't get paid leave, why is that allowed to happen?
Yeah. I mean, it's a great question. I don't know the full history. Maybe Jodie can chime in on that one. But I know here in New York and in New York City in particular, we put a paid sick leave policy in place a few years ago for a variety of workers who had not had it in the past. And I worked on a study citywide that looked at the impact of that policy on restaurant workers in particular, who were exactly the kind of worker who was coming to work sick and because of having to make ends meet. And it makes such a difference for people. And restaurant owners would say, this is difficult to implement. We don't know how to do it. We don't have the systems or the experience. But with time, it's something that they were able to do and provided a lot of support to workers. I mean, this is a bit of a tangent and maybe a separate conversation that we could have. But there's also the question of workers knowing their rights and being able to speak up and ask for those protections. And I think with new rights like paid leave, that can be on the books. And if we don't do a good job of communicating that and empowering workers to speak up and protecting them when they do against retaliation, it's going to be really hard for that policy to be successful.
No, it's not a tangent. It actually was my next question, so we can go a little bit more on it. But Jody, answer the question about what worker protections, and maybe you have more history on why paid leave is not a guarantee for everybody.
Yeah, and I apologize. I don't have the exact history on why paid leave is not guaranteed for everyone. I do know that it is paid leave is again, it's one of those things that is state by state. It is, and then even in state by state, right, it's whether or not there's even a couple separate tiers under that. It's there are some employers that offer it just because they offer it as a benefit. um there are places where it's negotiated into a union contract. And workers have advocated for it. The and I think Emma kind of hit the nail on the head. And it's interesting to see how the attitude towards this has shifted uh, as a result of the COVID-19 pandemic. Employers actually granting paid leave, federal policy to support it, employers granting paid sick leave, and then just watching as people are sort of scrambling now to. I think what has been interesting, I'll say this anecdotally, is that um, the under the emergency legislation as a result of the pandemic, most employers were able to grant paid leave and get some sort of federal reimbursement for it. When those emergency orders expired 2 years ago, employers were sort of in this like scramble. It's like, do I revert back to my default of we can't offer paid leave, or like now I have to wrestle with the fact that I've seen that paid leave actually works in the sense that people are not as sick, people are able to take off. I'm able to actually operate over a long term, and how to and watching employers wrestle with that, particularly in states where it's actually frowned upon, has been really interesting. I live in Texas, and just um, in talking to other business owners. I'm in Austin. I'm a member of the Black Chamber of Commerce in Austin. And just in talking to other business owners and them saying, wow, actually, paid leave is kind of a good thing. And we're really trying to figure out how to implement it now because we've seen the benefit of it. And I think the other layer to that too is that, and we'll come back to your second part of your question, Lydia, but I'll go off on this tangent. We also look at, there's also an interesting correlation if you look at uh, uh, pay leave as it relates to parental leave, maternity and paternity leave, right? And states that have paid leave policies have lower rates of maternal and infant mortality rates. So, again, just coming back to like just all of those things are sort of interconnected.
I love how both of you have like also superseded most of my questions because my next one was going to be about parental and maternal um leave, but before I get that, I do want us to talk a little bit about hazardous environments, and in particular I want to talk about this issue of when an environment work environment didn't start out hazardous and can now possibly be hazardous. And what I'm thinking about is the question I was gonna throw to Jody, but I think Emma can answer it too because of the work of particularly in the home health aides, was now at school shootings and us talking about possibly arming teachers or the harm that teachers are put in, right? And so how do we mitigate or work through? I know I opened up a can of worms. I can see it on Jody's face, but I think it's actually really important because we're now talking about people who are not trained to do that kind of work. And honestly, this is my opinion. This is not the opinion of the National Urban League, should not be trained to do that kind of work. They're trained to be teachers. They're very good at what they do. They're educators. To now have to think of this other hazard that, used to be not a thing to think about, but now is like really prevalent. And so it goes into this other section of like, gun violence and thinking about gun laws are now worker protection laws, right? It's also thinking it's getting into this social determinants that like they're all interconnected. You can't see them as separate silos. I'm just worried about gun violence. No, because that can spill into your schools. But I do want you to just talk about how in particular you may or may not know unions are thinking about this issue of protecting workers in a environment that they didn't originally have to be protected in that
I,
kind of way.
so I'll start. That's something that I dealt with my time at AFT. We dealt a lot with. One of the last positions I had was I was a regional organizing director, and so I had states where we had school shootings. Unfortunately, look, let me just start by saying this idea. Like, let's just look at the numbers, right? This idea of arming teachers. I just deal with that one really quickly. Trained law enforcement workers in a stressful situation like a active shooter have less than a 30% accuracy rate. These are trained law enforcement workers that do this on a daily basis, less than 30% accuracy rate. So this idea that by arming people that are not trained, that are not put into these stressful situations on a regular basis, is going to affect the outcome of that situation. The numbers just don't add up, right? Like the accuracy rate is going to go way down. And it also allows us to divert and skirt around the fact that like school shootings are a mental health crisis in this country, and we don't actually want to deal with the mental health crisis. It doesn't exist in other countries where they actually deal with mental health and they actually have access to health care, which allows people to deal with mental health crises. So, I just wanted to address that one real quick. If you look at the work that has been done around around worker protections around this. There's not only is it the unions, but unions in partnership with groups like Every Action, which stemmed out of the the mass shootings in Connecticut. Those groups are all advocating for higher safety standards, right? Like there are things that need to be in place, like um, I'm sorry, let me back up. Higher safety standards that include dealing with mental health, being able to identify students or family members that are going to have mental health crises. Um, but really, it's less about they are advocating for smarter gun laws, not not more protections at the workplace, if you will. I think that everybody agrees that having school resource and school safety officers are a necessity in schools, but also you have to look at the disparate impact, and which is the flip side of that is that we over police in Black and Brown communities. So in a place like New York City, for instance, the unions have advocated against not having actual police in schools, but having resource officers that are trained to deal with again, mental health, that are trained to do like student interventions, right? Like we're not actually policing students, but we're trying to help people deal with whatever the thing is that they're dealing with that is the root cause of why we get to these acts of violence. Um, so, I think in a very roundabout way, and I could go on about this all day, in a very roundabout way, like the answer in my mind is that we actually have to deal with the health crisis that we face in this country. As at dealing with the health crisis, and that's what a lot of workers are advocating for. Teachers will tell you the best way to impact discipline in a school, as an example, is to decrease class sizes, increase wraparound services. Those are the things that we know work. Um, and as we as advocates, as we like to say, your budget always reflects your priorities. And we say that we want to improve, student safety and improve outcomes for students, but our budgets don't always reflect that. We're cutting budgets to schools in critical areas that are going to actually affect students that we know work.
Thank you for that. I couldn't help myself. I know, and we have a couple of questions in the chat I'm going to get to, but Emma, I want you to talk about it from the perspective of the workers that you work with, and particularly
Yeah,
health aides. They have to pick up people sometimes out of wheelchairs. They have to get people in and out of beds. Those
yeah.
that's and then so please talk a little.
Yeah, no, I mean, I think what Jodie was saying in some ways is very relevant to home health aides as well. Their work environment is the home. And so that is an unregulated work environment that has any number of potentially hazardous conditions in it. And so this is something that domestic worker advocates and organizers and policymakers have been thinking about for a while. And I think the answer is different but similar, which is that we have to take this much broader and more holistic and encompassing view of societal health. We can't suggest a downstream solution that's trying to, you know, arm teachers with guns, but rather think about mental health mental health policy, mental health care access at the community level, thinking about poverty, which might be one of the reasons that homes become dangerous, work environments. There's so many um, different aspects of our social safety net that could be shored up that would make these healthier, safer work environments for home care aides.
No, I think that's a good point. And what I love about this conversation that I'm going to get to the first question in the chat is that it is us thinking through like this is a session on worker policy, work protections, but it's broader than that. It's all bigger than that. It is all these other policies and people get mad sometimes in public health movement where we say that all policy is health policy, but it is, right? Because if we're talking about gun safety, if we're talking about homes, right? How are we looking at and making sure that homes are habitable in a way that is supportive of people with who are differently abled and being able to stay in their house and get in their house and have to a worker like understanding all of these factors is important for understanding someone's health. And so you can't just stay in your silo of I just deal with work because so many other things are impacting and bleeding into the work environment and not making it safe. And so one of the questions I thought was a really good question that was coming off. One was a comment. Somebody just said, preach Jodie, which I appreciate. But another one I thought was a really good question. I'm going to say I'm answering it live is can either of you speak to the Department of Labor's overtime rule that goes into effect July 1st, 2024? Looks like Jodie. Go ahead, Jodie.
Yeah, I mean, I just a couple things about it really quickly. The quick overview of it is that it raises the threshold for what a professional employee is, the salary threshold for what a professional employee is. So it used to be it was very easy to say that I don't have to offer you. Employers didn't have to offer overtime to salaried employees because they were salaried employees, and the DOL's salary threshold for that, I believe, was just around 40,000. Um, and the new ruling is going to raise the threshold to it's somewhere north of 48,000. Um, and I'll say I'll tell a personal anecdote about this as a campaign and organizing director. I actually, I was put into the position of being the boss for organizers that worked for us on different campaigns, and they had collective bargaining agreements, and we had to bargain contracts. What that basically means is that we have a culture in this country of salary employees. They work till the work is done, right? There's no set hours around. Um, the now what the new DOL rule is that it just raises what the threshold is for a salary employee, how much you have to pay them for them to fall into that category of there's highly compensated and professional employee, for them to fall into that category of professional employee. Um, I think though, going back to something Emma just said, right? Like that is the direct impact of that is that you either pay people more or you have to pay them overtime if they work more than 40 hours a week. Okay. So that's just very dry what that means. But Emma said earlier, we have to actually look at a more holistic approach to how we view workers' protections and our social safety net and how all of those things are interconnected. If you look at the most productive countries in the world, the U.S. usually falls around 3 or 4, right? The other top 10 countries have a 32-hour work week, even for professional employees, right? So, that is, I think it's just something about like thinking about how we look at work, right? Like, are there ways to, if people are gonna, if I'm not gonna pay people more, they have to work 40 hours or I have to pay them overtime. How are we either A, more productive at work? And by more productive, I mean allowing people to feel more comfortable so that they can be more productive. Or or B, let's pay people a little bit more and put other things in place that we know help make people more productive, like more paid time off, et cetera, that actually allow people to be more productive. And it's a little bit of a growing pain for us, for our just culture in the U.S. Right? Like we live to work instead of work to live in this country. So it's a big cultural mindset shift for us. But again, I always go back to the numbers. Again, we're always 3 or 4, but if you look at how we're ranked against other countries that have higher quality of life, they have lower amounts of lower work week hours. So
I want to just build on that. I mean, I think that's such a wonderful set of points. And, moving this in a direction of thinking about health equity and thinking about that more holistic approach, one of the things that we've seen in the work that we've done with home care workers is that they are under a lot of stress on the job. Frequently they're kind of negotiating with family members. There's actually research showing that there's very like pretty high levels of verbal assault and physical abuse on the job for aides. And they, what we've heard from them directly in the studies that we've done is that because they don't have a lot of support, protections, access to mental health care, access to other kinds of health care, that they bring this stress home with them. And their families and their community institutions are the ones that support them. And I think when we are not supporting those communities and families to do that work with a kind of hollowed out social safety net, we're really exacerbating existing health inequities. And so that's just what I'm thinking about as I think about the need for all of these really important other kinds of social policies that are supportive of worker health and health equity.
Yeah, and I think this brings me to the question that I was going to ask before about, and I want to also say we got about 20 minutes left to the webinar. Anybody who's on, thank you for the folks who already asked questions. Put it in the question and answer if you have any particular questions or comments or thoughts you want the panel to address. But what I thought about is this idea of besides paid, sick leave, paid family leave. It was a big issue, and I can't remember, I think it was the presidential campaign that Hillary Clinton actually was on, that, one, because she didn't win, and also two, just because, what happened to our country and then COVID really kind of didn't stay in the forefront. But going to Jodie's point, we are one of the few, well, whatever you want to call us, high income, let's just call us that, because we have all sorts of names for what the US is, countries that does not offer paid family leave for the mother and the father, but for two parents, right? Whether it's, whichever parent, the birthing parent or the non-birthing parent, right? We don't offer, a lot of places do not offer paid family leave. And if they do, for example, the non-birthing parents make time just gets 2 weeks, which I think is crazy. Because the birthing parent needs support, but the non-birthing parent needs to have bonding with their child, right? It's also like going back to what you're saying holistically about the family. So, you know, what do we think? And I'm just asking your opinions, and I know both of you kind of have some information about evidence. Like, what made the U.S. not be a country that supports paid family leave, right? Like, what about our systems is creating that? And the other one I want to talk about is um, Jodie was talking about all the other countries have 32-hour work weeks. We're also the largest country that leaves PTO on the table, right? Many people who have personal time off don't even use it because of our system. Whereas, you go to Europe in August, nobody's there, right? They all take 2 weeks off. Everybody does it. They don't care. They don't care what tourists are coming. They are gone. They take their PTO. So I think I want us to talk a little bit about the culture of our country, because I think Jodie started about that allows kind of these cultural norms to go forward.
Yeah, I mean, I think it is a cultural question. It's a question about capitalism and the way that we have taken that up in this country. And I wish I had better answers to these questions, except to say that I do think that the people who have the most power do not see their they they're not seeing the interests of the other people in the room who would benefit from paid parental leave, from paid time off policies, from the kinds of flexibility that we know are so important for infant health, parental health, family health, community health, etc. So I wish I had better answers. Maybe Jodie does.
You know, I think Emma, you hit the nail on the head, right? It's the history of how we took up capitalism in this country, right? Which is that's a long answer that I'm sure somebody way smarter than me has wrote a dissertation on. Um, but I think the only thing that I would just add to that is that um, you know, evidentially what we see is that as we move further and further away from sort of implementing those like worker protections and allowing people to take paid time off, we're also seeing things like the wealth and income gap grow, right? So people are getting richer because they're working people more. So the answer is, yeah, to me, the answer is, the reason we don't have it is because rich people are going to feel like they're going to get richer if people work more. Which again, the numbers don't always support that, right? We look at what productivity actually is. We look at places that have higher quality of life for workers, and the gap between the CEO and the lowest paid worker is a lot smaller, right? Like in those countries. So I, I think that is, it just at a very rudimentary level, right? Like, we have a culture of work, work, work. And actually, lady, I appreciate you saying like you go to Europe in August and everybody is gone. Um, you actually get scolded for leaving PTO on the table, like your employer doesn't let you do it. And it's just here we have done a very effective job at building this culture of if you work yourself to death, then you did a great job. um we used to always in labor, we always say the one thing that Karl Marx didn't account for was the labor movement. Which is why this country didn't shift, we didn't shift completely to communism. We used to say that anecdotally. I don't know that I necessarily agree with that. I think it's more nuanced than that. I think the one thing though that the counterpoint to that is that as worker movements started to build and we started to look at things like that, like how are we improving worker quality of life, the thing that worker movements didn't account for was uh, uh, really like how federal law can placate people.
That's a super good point. And that also these different layers of law, federal law, state law, local laws. Like, like Emma pointed out that New York City has, a paid family, sorry, sick time, paid sick time as part of, but it's a city policy. Does not mean it happens in the rest of New York State, right? So you also have jurisdictional. I want to put the comment because I think it's a good one, and then I'm going to go to another one. So thank you, Maisha, for telling us this. So in Washington State, she says both parents are entitled to 12 weeks of paid family medical leave. Birthing mothers are eligible for up to an additional 4 weeks if there are OB complications and require bed rest or something related. Additionally, our minimum salary threshold for exempt employees is almost $68,000. I think that means everybody's moving to Washington State, because but this is, I think this is a point that we're also trying to make also, is that a lot of this is state dependent, right? The federal laws almost become a little bit of the floor, instead of the ceiling. It's the floor. It's like, this is the minimum you have to do. And then certain states, we know, a lot on the coast, but not all of them, have decided to do more or less, most of them more because they have strong worker protections. And so that's part of the problem about, where you live in this country is changing kind of the protections you have. So I'm trying to somewhat end this on a positive note, I'm about positivity. So we have on this call a bunch of Urban League affiliates from all over the country, and we talked about kind of state level issues. What is it that our urban leagues can do to kind of move action forward, help kind of increase worker protections, and what are kind of the policies that they can help advocate for or support that in their state, which may be a little different, that can move the needle on making sure that the workplaces that people are in are as safe as possible and protect them as most as possible, not only their physical well-being but their mental well-being. So like Emma said, you're not bringing that stress home to families, which can cause all sorts of issues within the family because the parents or the caregivers can be stressed. So I want to kind of round robin this, and then I'll see if there's any more additional questions. Anybody can take it.
I think it would be a really wonderful thing. Maybe it's already happening, but for affiliates to think about what kinds of workers in their region or in their state are most at risk for health inequities, and to maybe do a community forum on that issue, maybe partner with, if there are relevant unions, partnering with unions to speak to that issue. If there aren't unions involved, there are also worker centers out there that folks might partner with, and those are groups that are usually started by low wage or marginalized workers in industries where there typically hasn't been union involvement, and they do advocacy, they do training, they do various kinds of support. So those are a great resource. And Jodie spoke about OSHA earlier, and I was thinking also about the COSH groups where there are some state level COSH groups. So those are committees or sometimes coalitions on occupational safety and health, that help workers know their rights and help really put worker protection into action once it's legislated. So, the idea of partnering across those groups and shining more light on these issues is the first place my mind goes.
What Emma said. I think any ways that affiliates can aid in giving workers voice. I think is going to get us closer to fixing a lot of these issues or helping to increase worker protections. The one of the things that we don't do very well in this country is that we don't actually listen to the people that are actually on the ground doing the work, right? For my own bias, I'm always going to say allow people to unionize, but as Emma said, in places where that's not the case, there's not relevant unions to part with that doesn't exist. Anything that affiliates can do to help elevate and lift worker voice from complaint to action to policy is would be phenomenal.
And I just realized we kind of danced around a lot what a union does and what a union is, but I think it's important to say, because I think I loved your point that you just made, Jody, about like, I would allow people to unionize. But as Emma said, and you just said, not everybody can unionize. We know that a lot of groups, Amazon, other people have, Walmart have tried to unionize and it hasn't happened. And so there has to be alternative. But what are the advantages? And this is not to be pro union or against union, but what are, because I got to be neutral, y'all. We're a nonpartisan group, got to be neutral. But what are the advantages of unionization, and why would you suggest that as a mode of getting workers protected?
I'm going to let Jodie take this one, even though I am so enthusiastic about unionization as a measure moving us towards health equity. And there's plenty of literature to show that, but I'll let Jodie take that one.
I mean, so, just at a base level, right? Unions, by definition, allow workers to bargain over their wages, their hours, and their working conditions. And then, as when we say working conditions, there's all kind of different things across industries that fall into that, and it's sort of a catch-all. So that's just at a base level, by definition, what they do. Um, I'll be as I'll do my non-bias for a second, right? Like in any institution, or anytime you institutionalize something, there's going to be good and there's going to be bad. So there have been some negative outcomes of institutionalization of unions. But at the end of the day, what we're really talking about is that any space where we're empowering the people that are doing the work to do just that, to advocate for their own wages, hours, and working conditions against their employer. And when we say, the reason I say advocate is that this doesn't always have to be an adversarial relationship. There are a ton of places where there's a great working relationship between the boss and the workers in a unionized workplace, and they see each other as mutually beneficial entities. So, you know, by definition, they empower workers to bargain over their wages, hours, and working conditions. There's good and there's bad and everything when you institutionalize and you get people involved. But I will say, I think the places where we've seen like bad union activity is where it has moved further and further away from the workers, and there's like these people, these bosses that are over it that are calling all the shots and not actually listen to the workers and the people on the ground that are doing the work. Um, but the benefit, just to answer your question, the benefit is that it allows workers at a base level to bargain over their wages, hours, and working conditions.
I think I want you to a little bit, and I think Emma can also talk about this point that you just said. It doesn't have to be adversarial, and actually can be advantageous for both sides. And can you talk a little bit about that? Because I think that's something that we lose in the kind of should we unionize argument, and unions are bad or unions are good. Like when they do work together really well, what are the benefits that accrue to each side in that kind of way?
I mean, I'll just say very briefly. I mean, I think better communication, better aligned values, better productivity as a result of that. Um, this is a little bit more on a micro level, but there are, participatory projects that bring even like outside of a union, that bring labor and management together to sort of identify what are some of the health threats that exist and how can we work on those together? What makes sense for both sides? This is some really, I think, really exciting work out of the University of Massachusetts at Lowell. They've done this in hospitals with nurses. They've done it in a variety of places. So I feel like I've seen those smaller scale examples of how it really can be very collaborative and doesn't have to be adversarial, but I'll pass the mic to Jodie.
I'll go micro and then more macro, right? The current president of the AFT, Randy Weingarten, has a statement she started saying, uh, teachers' working conditions are students' learning conditions, right? So, to the question about where it's non-adversarial, right? Like, let's take education. Teachers are giving you a very, very like on the ground, in the minute representation of what's happening in a classroom. And in places where that voice is, is actually listened to, and again, there's good and bad on all sides, both sides of it. In that place where that voice is actually listened to, you're able to actually build out policies that are going to benefit the students in the long run. That's a very micro view of it. Yeah, real quick example is that most local teachers unions have what we call educational issue arms, which is like teachers that get together that just think about education policy and implementing better teaching standards, right? And how are they supporting teachers as they come through the pipeline, and either supporting them to become better teachers or counseling them out because it's not a good fit for them. That's all like internal worker based stuff that happens. Um, on a more macro scale, I think it is the at the end of the day, workers want to see their employers do well because it's their employer, right? Like people don't want to lose their job. So it is that type of relationship of we have to make workers are saying we need to make this as good of a workplace as possible. In places where employers are transparent and saying, look, this is our bottom line and let's build from there. Those relationships actually are really beneficial. And the UAW, I think the UAW strike, if you look at the history of the UAW, right, like that's a great example of how you had a adversarial relationship to start. You built a collaborative relationship. As you moved away from the collaborative relationship, you started to see like how um, like the productivity and the profitability of the big three started to go down. And then they got back together and they became more profitable until greed set in. And now we're saying, whoa, 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 now we have to come back and actually it's sort of that ebb and flow. Um, but now, still the most profitable automakers in the world are the big three.
Well, I love that. I love that when we're almost at time. I think the last point I think I would like to make, I'm going to make the point because I think both our panelists said it, but it's a really good point because we talked a lot about state level actions. Is that, and Jody actually said it in the beginning, and people are tired of me hearing saying it this on these calls, but I'm going to say it on every call because civic engagement is important and voting is important. And remember that who we vote in to our state, local, county levels are the ones who are making the policies that impact the actions that happen in our lives. So we voted in people in New York City in the past that gave us paid sick leave, right? That could not have happened if there wasn't a particular mayor in place who, whatever you felt about him, who made that policy, right? And so similarly, governors, Joey talked about the 10 Medicaid, the 10 states that did not expand Medicaid. And we're seeing what's happening in those countries. So in those states. So it's important for us to know that who we put in there needs to represent our best interests, and voting is how we determine the folks who are in there who can represent our best interests. So I know this group knows this, that our affiliates are all about reclaiming your vote. That is our voting campaign. But I think it's really important to continue to put that, like, policies come from people who are in office right now. And if we want to impact policies, we have to make sure the right people are in office. So I just want to say thank you so much to these two wonderful people who, like, this wonderful conversation that we just had, for taking the time out of both of your busy days during, spring breaks and all sorts of stuff, to take the time and talk with us. We had one last question that was just not a question. It was a thank you so much for this rich conversation. I can't wait to go down the research rabbit hole on the new employment professional wage salary increase policy. Well done. And that's from Shamira Wright. And so I just want to say thank you again, everybody. We're at time. But I appreciate everybody staying on an extra minute. And this will be on our YouTube page in a couple of weeks. Thank you all so much. I don't know if there's any final words that either one of you want to say.
No, just thank you so much for the opportunity for the conversation.
Thank you both. Have a great afternoon, everyone. Bye.